And we are live. Thanks for joining us, folks. This is Dr. Sarah Merritt, and today I have a special guest from In Touch Primary Care, Dr. Lola. And I'm Sarah Merritt with Lifestream Health Center. We're located in Bowie, Maryland. We are working to make pain management care more caring, accessible, and patient-centric, evidence-based. And we want to educate our patients and patients like them better about how they can live life better with chronic pain. And so we're here to talk to doctors, other folks in the healthcare space about how we can all live life better. So today we have Dr. Lola, and I'd love to have you introduce yourself.
Sure. Thank you, Dr. Merritt, for having me. My parents live in Bowie, so it's nice to make that connection.
How did I not know that?
Yeah, so I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor. I am based in Sugar Land, Texas, which is a suburb of Houston, Texas. And I am CEO of In Touch Primary Care, which is a clinic, concierge-like clinic in the Sugar Land area. And I'm very happy to be here.
Yeah, that's exciting. That's exciting. Yeah, what a connection. That's amazing. Yeah, it's a great little area, and it is so connected to many people. Just again, Bowie, we're central in Maryland, close to many things.
Exactly.
And I'm going to put your contact information in the comments here for anyone who wants it. So tell us about how you got interested in medicine and primary care. I know you've shared a little of your story with me, but I think it's really interesting and would be great to have people know a little more about your background and how did you get to being interested in primary care particularly.
Yes, thank you for asking that. So while I was in medical school and residency, always would think, how could we have prevented this? So when I see a patient and they are, end stage renal disease or where they have uncontrolled diabetes or whatever it was, I just always found myself wondering, how did it start? And how could we have prevented this? And so when I was choosing a specialty towards the end of medical school, I just knew that if I wanted to do preventative care and I wanted to do it at the beginning, primary care was the way to go. And so that's how I got really interested in primary care, because I felt like that would give me the best opportunity to practice preventative care.
That's really great. Yeah, I think that's like really the place to make the difference too. But yet it's so hard to measure that, right? Like, because you can't run that scenario of life both ways, like life without Dr. Ashaye and you eat too much sugar and you get bad diabetes versus the other scenario when the patient has a great relationship with their great doctor and adopts healthier behaviors and doesn't develop those things.
Right. And that is the tricky thing, right? Because from my perspective, I could see it through seeing different patients along the way, right? So over the years now, I've seen a patient kind of, not doing so bad. And then maybe another patient who was like that patient 5 years, later, now doing a little bit worse. And then maybe somebody at the end stage. So I could see where it's going, but the patient doesn't see that. So when I'm saying, stop, don't, it's a little harder to explain why you're making it such a big deal, because you could see what will happen if we don't address it now, but they can't. So there's an art in trying to communicate that to patients so that they understand why we're so passionate about fixing it now.
Yeah, I like it. Well, and Dr. Ashaye you were sharing some of your story in terms of wanting to build those long-term relationships with patients. I think that's really interesting and compelling. And I can say that I can relate to that because when I just looked at the doctors and mentors that I had coming through, particularly as a pre-med and some in medical school also, a lot of those doctors who were primary care and had great relationships with their patients, a lot of those were the people I wanted to be like, that were
Right.
great with interacting with their patients and really seemed to enjoy their job also.
Yes, and that's huge for me in primary care, and because that's gives me the best opportunity to have that relationship, a long-term relationship with my patients. People will always come back to their primary care doctor and say, "Oh, the cardiologist said I should start this." I sent them to the cardiologist. They came up with a plan of care, and then they're coming back and saying, "Oh, should I start it?" I'm like, "Yeah,
They
yeah,
want
you
you
should."
to bless
Right.
it.
They
Yeah.
want to be sure that you're. So there's definitely a trust built when you have a relationship with patients, so special. And I'm happy that, especially within the kind of model of the way we deliver care at our clinic, we're able to keep that relationship long term, regardless of, people's insurance or job status or all kinds of
Mm.
factors that come to play in other scenarios. So it's a very special thing.
Yeah. Yeah. So that is unique about the direct primary care. Really, the patient might change insurance, and it doesn't necessarily change anything with your um, relationship with the patient or the payment or any of that.
Right, right. And I really, really like that because that was one of the things that frustrated me the most.
Yeah. Were
And
you losing patients if their insurance would change in the past?
yes, and not only will you lose them, you even know because they
Yes.
just
They just
don't
disappear.
show up. They don't have that opportunity to let you know because they get stopped at the front. And
Mhm.
some of them will maybe write a card and let you know, and you call them like, "What's going on? Oh, I changed jobs. Do you guys no longer take the insurance this job provides?" And so that's it. It's like it's sad because
Yeah.
you've built that relationship, and all of a sudden it's just gone for that reason. So
Yes. Yes, that is challenging. I think there's definitely a lot of challenges in the healthcare system these days, and so I see this as a way to try to work with it. And I don't want to talk too much about the financial piece of it, but I guess I can't help but ask, and I think this is true. It's not. Is it necessarily more expensive for the patient? It might be initially, but then not long term. How does that work, or how should a patient think about that?
yeah, so I think it is. I believe patients actually end up saving money in the long run because they
Uh-huh.
save money in the fact it's not membership fees are not as expensive as people would think because our overhead is a lot lower when we cut out that insurance piece and we
Mhm.
pass on those savings to our patients. So that's number one. We also have relationships with testing centers that make it a lot more affordable for our patients as well, and we pass those savings along as well. So overall, the fact that they have those savings within the membership and the fact they have easy access to us, saving them from going to the emergency room, urgent care, that sort of thing, it really makes it a lot more affordable compared to sometimes even more affordable than if they had insurance.
Yeah,
So,
that's really interesting.
yeah.
Um, well, and let's talk a little about lifestyle medicine. And speaking of saving money, right? And maybe I'll share a little anecdote, but in terms of lifestyle medicine, the idea that we can improve our lifestyle, improve our health, and be better, be more well by taking good care of ourselves. And so this is a type of practice, it sounds like, that you have.
Yes.
And so
So,
my anecdote, I would say, is my uncle. I have an uncle who was diabetic and had a kidney transplant. He was a bit overweight. Um, and they had been to a visit with their primary care doctor. And my aunt was speaking with my mother and was like, "Did you know?" Like, finally, at some point, and he's, overweight and diabetic and has had this kidney transplant. "Did you know they were saying that he could maybe stop like 3 of his medications if he could just lose like 15 or 20 pounds?" and
yes.
and the minds were blown. So if you want to talk about interventions that save money, and,
Yeah.
and the healthcare system as it is, like, they had just never had that conversation with
Right.
anybody. It was just all disease management of like, well, here's where you are, we got to do this thing, you got to do this thing, versus like, well, let's really look at where we are and like, is there anything we can improve here?
Yes. And yeah, that is a great, great, great story. And that is so true. I think we underestimate the power of just natural things, food, physical activity, sleep, stress management, all those things come to play in health. And when people are able to, weight loss is is part of that. But I tend to really emphasize just wellness, eating healthy in general, because there are a lot of people that are not overweight that are not necessarily healthy either. So
Mhm. Yeah.
so sometimes, the weight it shows, but many people hide it very well. So so just making sure that people are aware of just changing your diet has been shown, especially people if you go more towards a whole food plant predominant diet. A lot of people can lower their blood pressure, lower their cholesterol, get off their diabetic medication with doing that, in addition to incorporating physical activity, um, proper sleep, and reducing stress, social connections. There's a lot that goes into health that can be done with just lifestyle behaviors that I think, sometimes underestimate. Um, and
Mhm.
just understanding how to do it as well um, can be is definitely helpful.
I like what you said just now too, to include that plant predominant diet. And on the one hand, there's a lot of literature around a plant based diet, which might be free of any animal products, but I think that's a little intimidating for a lot of folks.
It is.
And so I like that verbiage. I don't know that I've actually heard it said quite like that before. Tell me more about that type of diet.
Yeah, and that's exactly right. It's very difficult for many people to go from eating, meat, which they grew up with as part of their culture, to saying everything has to be completely plant-based. So the way that has been effective for me is just encouraging people to add a lot of plant-based food in their diet, whole food and plant-based food, and not think too much about what they cannot eat, but think about what they can add to make it healthier. And when they have that mindset, they don't feel like they're missing out on stuff, because when you say don't eat this, don't eat that, don't eat, it just gets a lot. Like, you're diabetic, you have high blood pressure, you have cholesterol. That means you can't eat sugar, you can't eat fat. You can't eat. They're like, what can I eat?
All the cans, right? Yeah.
Everything. Like, I can't
You
eat
focus on
salt.
what you can do, what you can eat.
Right.
Oh, yeah.
Right. So they
The
get so
positive.
frustrated. They just turn
Yeah.
off. They turn off when you say that. And I can completely
Oh, yeah.
understand that.
Hmm.
Yeah.
Hmm.
And so when you say instead, you can eat as many vegetables as you want. You can eat, all these berries. You can have as many nuts and seeds as you want. You can eat then it
Hmm.
kind of makes them feel a lot more empowered. Like, okay, all I have to do is add on as much of this as possible. And then naturally, as they do that more and more, they have less space for the other stuff. And so,
Right.
and yeah, and so that's really the way I try to go about it. And then with physical activity, it's, yes, you cannot do 1 hour every day at the gym. That's fine. Let's start with 5 minutes, you know,
Yes.
let's start where
Yeah.
you
That,
are.
that is one positive thing. Yeah. Just do that.
Exactly. Let's
Mm.
just do that, and let's do that consistently, every day or 3 times a week, whatever you feel like you can start with, and then let's go from there. But something is definitely better than just waiting until you're able to do everything, because that day usually doesn't come, immediately.
Mhm.
Yeah.
Yes. That's great. I think, and you've been successful, it sounds like, in having some of these conversations with patients to try to help them move toward a more plant predominant lifestyle. Is this something you discuss with all of your patients or just some?
Yeah, so I try to discuss it with all of my patients. It depends on where the patient is, because this is a partnership.
Mhm.
Some people don't want to hear that yet. They're not in that
Yeah.
position.
No. Yeah.
to-
Yeah. Yeah.
so I just kind of get a feel for where they are and kind of try to meet them where they are, ask a lot of questions about what their goals are, how they want to meet it, if what they're doing will get them to where they want to be. And then over time, I can introduce more and more of that concept. And a lot of them are receptive when they don't feel like you're trying to limit them. I think a lot of them get
Right.
upset or just defensive, understandably, when you say you can't do stuff. So
Right. Right. Yeah. I think that idea around deprivation really is challenging a lot of times if a patient is doing a dietary change or an intervention of some sort. I think that idea of denial, I think is challenging.
yes, yes.
Um, and tell me more about encouraging patients to move more. I like what you said about just even 5 minutes doing something and, increasing. I suppose you would encourage someone to continue increasing beyond 5 minutes once
Absolutely.
yeah.
Absolutely. Yeah. And, studies have shown like even 10 minutes of physical activity does make a difference. 10 minutes at a time helps with mood, energy, and so many other things. So, there's actually a patient I just said, you know what, all I want you to do for now is just put on your tennis shoes.
Yeah.
Just put them on. Don't just put them on every morning, commit to doing that. Let's just start out with that. And then over time we can add on walk for a minute, walk for 2 minutes. I think the idea is helping people see that there is something that you can start to do now, no matter how small it is. And then over time it gets easier to keep doing it. And honestly, that's how it started for me. Even though, I never really struggled with weight, but physical activity has not been my had not been, I
Okay.
just didn't like exercising that much. It just
Mhm.
felt like, and I couldn't find something. And what I just did one day was I just decided I'm going to walk for 10 minutes. So I got
Mhm.
up, didn't think too much about it and just walked around my neighborhood for 10 minutes. And I just committed to doing that for a few, 5 days a week. And now I'm up to 30 minutes.
Wow.
So it's just a decision that you just do. And then,
Yeah.
but it went, the 10 minutes didn't seem that bad, for me when I started out. And now 30 minutes seems very doable, but I couldn't do 30 minutes when I started. I had to
Wow.
start with something smaller. So I understand when not everybody is the same. There are certain things, some people can do an hour very easily, but, that doesn't come easy for me. So I just started where I was.
Yes. Yes. No, I think that makes a lot of sense. And I think that idea that it's still a positive, right? That the patient should still like take that as a win, so to
Right.
speak, just for the effort and doing something, within your abilities.
Right. And one thing I would add too is sometimes it doesn't even have to be something organized. Like I think even just knowing that you're being intentional about movement makes a difference.
Mm-hmm.
So even if you're not calling it walking around, it could just be moving. Just
Yeah.
knowing that you're moving makes a difference, and maybe exaggerating some of those movements just so that you know that you're doing more. But and
Sure.
counting that as physical activity, I think it's helpful.
Mm-hmm. Cleaning the house, taking the stairs,
Yeah,
so those things can all count.
park
Yeah.
it farther away, those things, yes.
Yes. Um, yes. And I think to your point about like starting with 5 minutes, starting with 10 minutes, I think I definitely see that in my patient population because many of my folks with acute pain really have a hard time doing a lot of activities they would like to do. Um, and so certainly we kind of talk about working within your zone and abilities and whether it's, if walking 5 or 10 minutes is tolerable, or basic, chair exercise or Tai Chi, even five
Right.
or 10 minutes to start, just to get a taste and see what's doable, I think is really an accomplishment for a lot of folks. And then if it has to be enjoyable, right? It sounds like you enjoy your morning walks,
I do, very
or
much so.
or did you say you do it in the morning, or what time of day works for you?
Morning, I do it in the morning now, yes. And it helps to pair it, like pairing it with some, right after I'm done with brushing my teeth, I just
Mm,
put on my, I don't, the key is not don't overthink it, just start
okay.
doing.
Brush your teeth and go.
And just go, and then I really enjoy it now. And when now it's raining more in the Houston area, I just go on the treadmill instead, you know,
There you
and
go.
just make sure you have something as a backup if you can't
Oh, there you
always
go.
do what you
Yeah,
like to do.
that's next level. Yeah.
Yes.
You've made a decision now to get that movement either way.
Either way, exactly.
Mhm,
Exactly.
mhm.
So
Yeah, so
that
it sounds like
definitely.
you really do a lot of like coaching with patients in your practice and kind of talking through how they can incorporate more movement, incorporate more healthy habits.
Yes, yes. So that's one of the things because one of in primary care, a lot
Mhm,
of it is mindset, and you know, many people already know what to do, and
mhm,
they know they need to eat a lot of fruits and vegetables and physical activity, but where sometimes what is missing is maybe they don't completely understand why or how powerful it is, or they haven't found their why yet. So, um, a lot of it is coaching, trying to figure out, help them find their why and then helping them hold them accountable to some extent and helping them through it, so it is a lot of coaching, and then once they get it, they just go from there. They drive it after that, and you're just supporting at that point.
that's great.
Yeah.
Um, let's talk a little about like inflammation in the body. And I had asked you a couple questions before we got on about anti-inflammatory diet or is this something that lifestyle medicine speaks to? And are there foods that cause inflammation? What kind of tips can you give for someone who's wanting to live a more anti-inflammatory lifestyle?
Yeah, and that's important because we know that with chronic pain, inflammation is a factor, and inflammation is a factor in a lot of chronic conditions, actually, not just pain and heart disease, diabetes, so many other things. And we know for a fact that there are certain foods that do increase inflammation in the body, and things like meat, eggs, dairy, oils can increase inflammation in the body. Pretty much any high fat and things that have added sugar will
Mm,
do that. Um, so the way I approach it again is adding. What can we add to reduce
adding the
inflammation?
anti-inflammatory. Yeah.
Right.
Yeah.
So usually what I'll say is, blueberries, raspberries, pomegranate, the avocado, those are things that can be helpful to reduce inflammation. And even some studies have shown that when you pair these things with foods that increase inflammation, the net is better. So it doesn't increase inflammation quite as much.
Oh, interesting.
So,
Yeah, it
right.
neutralizes a little of those.
Yeah, a little bit. It reduces those inflammatory markers. So that's kind of how I try to approach it. At least not start out with saying, don't eat this. I kind of approach, okay, maybe we need to incorporate more blueberries, right? Which one do you like? What do you like to eat?
I'm gonna have my French fries with a side of blueberries.
There you go. There you go. And you start out there, and that's okay. And what I encourage is eat the blueberries first. Eat that first because
Okay,
that will,
okay, yeah,
that
you
will
got a
fill
point.
you up.
You got a point.
That will fill you up to an extent. Drink some water with that. Try to get your stomach a little bit fuller, and then eat after that, and then that should help some. So that's the way. And then hopefully over time you're less and less likely to indulge in the high fat, high sugar foods with more encouragement over time. But to start out with, it's more add in anti-inflammatory foods. Also, there's spices that have been shown to help, like turmeric, garlic powder, ginger powder, those types of things. And
Yeah.
definitely the more plant predominant foods that people can add to their diet, the better off too.
Mhm. Do you
So
recommend supplements to any of your patients, or do you talk about that type of thing? Is that part of your practice with
so
of those kind of things?
yeah, over and over again, food is always better than supplements. We can
Mm,
always get
mhm.
much of what we need
Food is
from
medicine.
food is medicine. Exactly. So if, I highly encourage trying to get it from food as much as possible. But obviously, there's some things that people will need to supplement: vitamin B12, vitamin D, the things like that, that
Mhm.
some people would need supplements,
Mm,
or even other supplements that have been found to be helpful. Some people would need to supplement with magnesium, things like that. So somewhat, yes, I do, but I usually would first push food as much as
food first.
possible. And then if they're already taking some supplements, we talk about it. We make sure, as far as I know, if I know of interactions, I let them know. If I don't, I let them know. I don't know if this is interacted with whatever else you're taking. So, you know, so that's usually the issue there. But for the most part, if we can start off with food, then supplements are really just like an add-on for most of my patients.
Hmm. That's
Yeah.
great. Yeah, I think I like that philosophy for sure. Starting out with eating um, those healthy foods to get the best nutrients in our bodies.
Yes. And I found that a lot when I ask many people, when you ask about supplements, they're not sure if it's helping, you know.
Mm, right.
So when I ask, what are you taking? And they tell me the list of things, and I say, is it helping? I don't know, but they're paying a lot for it. So,
Mm-hmm, mm-hmm.
so I say, try, sometimes you go off of it for a little bit and
See if it makes
see
a
if it
difference.
makes a
Yeah,
difference,
that's
because
right.
sometimes you just take in things and if it's not helping, what's the point?
That's right. Yeah, I think that makes a lot of sense. Yeah, I think the science data is really building for a lot of those things, and we don't have clear answers. As far as the benefits of all supplements for all people.
Right. Right. And
Excellent.
source comes into play too, because there are so many. Those are not necessarily looked at as closely as medication. So that's the other part that sometimes is not very clear. It might be a good supplement, but we don't know where the source and if it's truly whatever they say is in there or not. We can't confirm that.
Right. Yeah, that is
Right.
that is challenging. That is challenging. Very good. What else? Are there other updates in the field of lifestyle medicine and primary care? Do you have other things you want to leave us with?
Yeah, I'll say two more things actually. Sleep is important. I think
Mhm.
that's another part of lifestyle medicine and just life that a lot of people sacrifice for many other things, for fun, for work, for sleep tends to go first. But sleep really affects health. And so that's one of the things that I try to encourage my patients to be intentional about getting enough rest, 7 to 8 hours a day if possible. But start where you are again. If you're getting 5, you're probably not going to get 7 right away, but try 5.5 and then 6 and slowly get there. But just thinking about it more intentionally, I think helps, not just assuming that it's okay to just get little sleep and be fine. So that's one thing. And then
Mhm.
the other thing is sitting. So we're finding that when people, like now, a lot of people work from home a lot. And even though they may be physically active, they get their 150 minutes a week, sitting is an independent risk factor for heart disease and even mortality.
Hmm.
So, yeah, so even though people are getting their physical activity, it's also important that we make time to get up as frequently as possible in between during the day. So the stand-up desks are great if
Mhm.
people can do that, or just making it a point to get up, every hour, every 20 minutes, as often as you can, just to not sit down all day long, which a lot of us tend to do. And so that's something I am working on personally too.
Absolutely. Yeah. Yeah.
Yeah,
I know. And some of that may involve retooling our workspaces, right? For many of us
exactly.
that are in a job, we may need to create a, how can I stand at my desk? How can I stand to dictate? How can I
Exactly.
do those things? I think for me anyway, that would require retooling the workspace a little bit.
Yeah, yeah, exactly. And then just being aware of it is just if I'm taking a phone call, instead of sitting down, sometimes I'll just get up and walk around the office because
Yes.
I don't have to sit down for that. So just finding ways to just incorporate it in the day without making it too complicated. So
Right.
that helps too. Yeah.
That's great. And so tell us more about where we can find you. So I've got our links here in the show notes, where Dr. Ashaye is in intouchprimarycare.com in
Yeah.
Texas, Instagram, Facebook, TikTok. Are you having fun with TikTok?
I am. I know. I got
Yeah.
dragged into TikTok kicking and screaming, but I'm having fun now.
There you go. There you go. That's amazing. That's so amazing. Well, I love it that your parents are in Bowie, Dr. Lola Ashaye. You're going to have to come visit us
Yes,
when you come to town.
I will. I will. I'll love to. Thank you.
That's awesome. Well, thank you so much for being with us. Appreciate your insights. And I just really would like to maybe also just add, hey, primary care is super important. And here you've heard why. It's a lot of the prevention and things, prevention and treatment of active, issues that patients have. I think it's so important for folks to have a primary care doctor, a go-to that can be kind of the expert in many things, and then also the quarterback of making those referrals and identifying where a specialist is helpful.
Yes, absolutely. Thank you, Dr. Merritt.
Yeah.
And it's so inspirational that you're, having all other doctors here helping your patients just in a holistic way. That
Yeah.
is, they're so lucky to have you because that
Oh,
is
thank you.
special.
Thank you
Yeah.
so much. Yeah, I want to introduce all the concepts, and I'm so glad you brought your wisdom.
Yeah.
Thank you so
Thank
much.
you.
Okay.
Thanks for having me.
Bye-bye.
Bye-bye.